Okay, everyone, welcome to the November 2025 webinar for Lotus Holistic Medicine and Lotus Institute. My name's Dr. Sandeep Gupta, and I'm very excited today to have Dr. Olivia Lesslar with us. How are you doing today, Dr. Olivia?
I'm good. I am actually at the airport right now on my way to the US. So expecting a bit of jet lag.
Yeah, we're all very fortunate to have this rare sighting of this digital nomad. Is that right?
Nomad, yeah, definitely.
Excellent. And so what we're really excited to announce tonight is that Dr. Olivia has created a online course for our institute and for our viewers, and it's called Mast Cells Made Simple. And it's about the condition of mast cell activation. And we'll talk more about that as we go along. And that's going to be the subject of tonight's webinar, is giving you some basic insights into what is mast cell activation and what can you do about it. It's going to be a slightly shorter webinar tonight, probably around 40 minutes, but I can hang around and do some extra questions. So let's jump straight into it. So without further ado, I'll hand over to you, Dr. Olivia, to introduce yourself.
Yeah, sure. Hi, everyone. It's a pleasure to be here. Thank you so much for giving me a bit of time as well, Sandeep. And of course, thank you to the Lotus Institute of Holistic Health. So I am an Australian registered and educated doctor, and I've been in the space for 15 years or so. And early on, I realized that there were definitely gaps afforded by conventional medicine. And then, wouldn't you know it, patients need to be heard. And there are some really weird and wonderful emerging syndromes in society at the moment that we can't wait for conventional medicine to tell us about. We got to keep our finger on the pulse, right? That's the whole point of continuing our professional development. Right. And anyway, my special practice of medicine is that I like to look at everything through an evolutionary lens. What did we evolve with? How our nervous systems are wired. I obviously do functional medicine in that I'm interested in root cause. I run a brain center. I'm the medical director of functional and longevity medicine at a brain center in Sydney that I run with Professor Charlie Teo. I suspect that these are mostly Australian audience, so they would probably know who Charlie Teo
is. They will be. Yeah, there won't be any Americans on this one because it's the middle of the night for them.
All right. Okay. Yeah. And so Charlie and I basically have this brain center where we do advanced mapping of the brain using connectomics and then neuroplastic adjuncts between transcranial magnetic stimulation. I have a big interest in complex multi-system conditions, diseases, mystery illnesses, and emerging syndromes. And my expertise that I basically go around the world and speak about now on stage and educate other doctors about is something called psychoneuroimmunology. So psychoneuroimmunology is the hard science behind the soft science of mind-body medicine. And when you know it, mast cell activation syndrome actually straddles both the complex multi-system issue and psychoneuroimmunology. And that's how you and I connected, Sandeep.
Yes, absolutely. And we got to spend a bit of time at Byron Bay Symposium this year, sharing some ideas around complex illness. And that's how we got together. And I basically asked Dr. Lesslar, hey, how about we create a course? And she said, not only did she say yes, but she said she was going to do it in 1 month. I thought that was pretty cool. A little bit about me. Most of you know me. I am a integrative medicine physician here on the Sunshine Coast in Australia. As you'll know, I'm very interested in complex chronic illness, but also integrative oncology, which is using all kinds of methods to assist patients suffering with cancer. And then longevity medicine, probably not quite as deep into it as Dr. Olivia is here, but that's becoming more and more of a passion. And I myself am doing a longevity program myself to try and just live as well as I can and healthy as I can for as long as I can. body psychotherapy. I've recently completed a diploma in body psychotherapy, and I'm very interested in how emotional trauma is stored in the physical body and how it can create a weakness, which can later lead to illness. So these are all little pieces of the puzzle. So other little random things. I was a shoemaker certified in his program of mold illness for a few years. That was very, very, eye-opening. Got to know Dr. Lawrence Afrin, who some people consider to be, the number one world expert, other than Dr. Olivia, that is, in mast cell activation.
No pressure then. Let's set very reasonable expectations here,
Yeah,
Sandeep.
that's right. That's right. And I did a few days with Dr. Afrin we've done some via video conferencing and then some in person in Brisbane. And I've done a Masters of Nutrition with Dr. Gabriel Cousins. So lots of different things. And my journey in medicine has taken me in all kinds of spirals through different worlds and explorations. So, what's today's webinar about? Well, really what we're trying to do is give you an idea if you yourself think you may be suffering from mast cell activation syndrome, and if you're a client of the clinic, Lotus Holistic Medicine, there's basically a large proportion of people who come to our clinic are suffering with this condition. And so we're talking a little bit more about how you can be diagnosed, what's some of the treatment, what are some of the challenges, and then is this course something that can help you on your journey, or are there other things that you need, other types of support to help you to move forward on your journey? So it's all about really trying to help people to just move forward on their journey of exploring mast cell activation. Anything to add to that, Dr. Olivia?
That sounds reasonable. Yep.
Good, good, good. All right. Would you like to do this one, Dr. Olivia?
Yeah, sure. Um, so I'm assuming that people here on this webinar are either interested in mast cell disease because they know someone who has mast cell activation or who themselves are suffering mast cell activation. I think it's just simply enough to say that mast cells are like sentinels. They're sentries, they're guards, they're first protocol. And when they sense danger, and we'll go back to the word danger, but when they sense danger or threat, they release these preformed chemicals, and those chemicals are going to elicit change to the tissues within which the mast cells find themselves. So if the mast cells are in the nose, for example, you can get nasal congestion. If the mast cells are in the skin, you can get itching. If the mast cells are in the small intestine, you can get cramping. Now, how can one cell cause so many varied symptoms? And that's because the mast cell, being a guard, has to know what the local terrain is that it is guarding. And it has to evoke a response that is going to be appropriate to that terrain that it's guarding. So it's actually very, very clever, but makes it a diagnostic nightmare for doctors who are not familiar with mast cells, and can be very frustrating for patients who are experiencing these symptoms, because everyone's saying mast cell, or histamine, but how is it that on one day it's my nose, on another day it's a migraine, and on another day it's diarrhea, right? And these diagnostic dilemmas can be very frightening and very lonely for patients. And I think that's why getting a very, very clear understanding about what mast cells are, and we go into this in the course, what mast cells are, what are those preformed chemicals inside? How are they going to elicit responses in different tissues? And how is it that one day you're fine, but the next day you're triggered when nothing that you've done has really changed? And it's about understanding.
Yeah, I totally agree with that. That's isn't that such a common thing? People just with mast cell activation, one day they're fine, the next day they can be terrible.
Because it's about, like, I don't know, maybe with anyone familiar with chronic fatigue syndrome knows about the spoons concept. And then anybody with the histamine issues knows about the bucket concept. But basically,
Mm-hmm.
it's your resilience, it's your capacity. And your
Right.
capacity changes day to day. You have one night of poor sleep, your capacity goes down. The threshold for mast cells to degranulate is going to change. And so we go into mast cells and we talk about all the different triggers, and we're going to talk about the different bioactive mediators, those chemicals inside, because when they're triggered and when they're released, when they're degranulated from the mast cells, what do? I have to say, like in writing the course, I realized just how unfair it is for patients because it's very complex. I mean, we're talking immune system here, innate versus adaptive. We're
Yeah.
talking
Yeah.
we're using words that doctors rarely use ourselves.
Right.
Heparin, tryptase, prostaglandins, like it's we only talk like that when we're talking to other doctors or pathologists.
Mm.
How are patients meant to understand all these complex words and complex systems? It took us years to understand it in medical school. So,
Yeah, right. And commonly people think of it as just being histamine, but what you're saying
yes,
is it's actually a symphony of different compounds that are being produced by mast cells that have an effect on wide spread tissues of the body. Is that right?
yeah, yeah, exactly. And then I want to talk about one more thing because I said in the beginning about how mast cells are going to degranulate or release those chemicals in response to danger.
Mm-hmm.
Now, your idea of danger is not my idea of danger. Your
Right.
system might be primed to get very agitated, very triggered, very scared by gluten, by mold, by pollen. But
Mm-hmm.
someone might have an immune system that doesn't see those things
Right.
in that way, right?
Mm-hmm.
Because they haven't yet been assaulted, let's just
Mm-hmm.
say,
Mm-hmm.
right? Um, so threats and dangers are not objective. They are subjective to the system. And whether or not that subjective threat evokes a response also changes because some days you have more resilience than others.
Yeah, exactly. No, that's a great explanation. Thanks, Dr. Olivia. And it explains why, I guess you could say sometimes mast cell activation's a little bit unpredictable and it
Mm,
changes and moves because it's such a symphony of different compounds and there's just so many different little variables involved. So I think that explanation really helped
yeah.
to clear that up. Okay, I can jump into this one. We don't want to get too caught up in classifications and so on. However, in terms of where does mast cell activation fit, so to speak, in terms of medical disorders, the umbrella term is mast cell disorders. So there are many of them, but they're not necessarily that common, while mast cell activation is very common in my experience.
In my
And
experience too.
isn't it? And so some, some textbooks and some immunologists are still teaching the idea that mast cell activation syndrome is rare, and that's certainly not the case with me. Even just in random people I meet socially, quite often I can see signs of mast cell activation. So I'd almost say that it's in a very significant part, percentage of the population, especially as we're getting a more and more toxic world. So
Yeah,
I
absolutely.
think it's probably the rule more than the exception. So it's basically comes under the category of idiopathic, which means that, the cause is not clearly known in conventional medicine. So primary mast cell disorders are where it's thought that the mast cells are fundamentally flawed in the person's body and they're creating the number of mast cells are increased and there's a massive increase. So mastocytosis is the classic disorder, which is basically almost acts like a type of cancer of the bone marrow. And there's so many mast cells and people are very, very unwell. So this is very different to mast cell activation syndrome. But that's often if you go and see like an immunologist or a specialist, they will try and exclude this syndrome. And then you can have secondary syndromes, secondary to allergy, chronic inflammation, cancer, and what we call physical or autoimmune urticaria. So the word urticaria just refers to like, when you get a red wheal on your skin, that's known as an urticaria. And then in the category of idiopathic, we have anaphylaxis, which is where people have a acute, serious reaction to some kind of trigger, whether it be pollens or, uh, it can be anything. It can be peanuts, I think is an increasingly common one, isn't it, Dr. Olivia? Yeah.
Hmm.
And angioedema, some people get that in response to medication. That can be where your lips swell. And then general urticaria or hives. And then mast cell activation, though, is really, I guess you could say it's the new kid on the block. It was only fairly recently discovered, but it's hugely important and significant. And I guess that's the point here.
Hmm.
Would you like to talk a little bit about symptoms, Dr. Olivia?
Yeah, sure. So remember before we were talking about the fact that where those mast cells are is going to determine the kind of symptoms that you experience. Mast cells are everywhere pretty much, but especially in areas that, as guards, they're going to experience, they're going to be the first port of call if something from the environment was going to try and invade your integrity. Okay, which is why skin always being in contact with the outside world is one of the
Hmm.
big places that you're going to get mast cells, and then mast cell degranulation and a symptoms of mast cell activation syndrome, what with your flushing and your itching and your heat and your hives and your pain. The cardiovascular system, the blood vessel system, right, that runs all throughout your body, that's the communication highway pretty much, along with the lymphatic system, right?
Right.
But specifically, the cardiovascular system is going to determine your blood pressures, um, your heart rate. Then, of course, your headaches, your migraines. I mean, people can read this list, but what I want to point out, right, because I don't know if people have put this together yet. Everything that you see, all these different reactions, the fatigue, the runny nose, the loose stools, the reflux, all these are actually uh, maladaptive symptoms for us experiencing it. But from an evolutionary perspective, it's your body trying to protect you.
Right.
So if you have um, uh, something land on your body like a mosquito, okay, what does your body elicit? What kind of symptom does it elicit to make you get rid of it? Itch.
Right.
Itching is an evolutionary way for you to get rid of something. Now,
Right.
remember, this is all subjective threats. In other words, your body, because it's so ancient, right? This part of the system is so ancient, it is going to say, okay, there's a threat incoming. I'm not sure where it is, or what it does, but let's just release the mast cells and all the bioactive chemicals, and we're going to elicit these different behaviors because those behaviors are going to be protective of you whilst we figure out what's going on.
Right.
So you get this itching in your skin. Now there may not necessarily be anything there, but just in case, your body's
Right.
like, just scratch whatever you can off. Okay, right? It's going to increase the heart rate because it
Hmm.
wants the blood to go around the system better. That's what the redness and the flushing is. Increased red cells to the area means more nutrients, more oxygen.
Hmm.
Increased white cells to the area means more troops to try and battle
Hmm.
whatever
Right.
enemy there is, right?
Hmm.
Getting reflux means increasing gastric acid secretion. Do you know why? Because if the enemy is making its way into your body via your food, the acid is going to kill it,
Right.
right? Getting, runny nose or mucus or tearing, all of this is meant to produce a liquid that's going to wrap itself around whatever may be trying to get in there, virus, parasite, bacteria, or pollen, right? And then it's gonna leak out of your body, or you're gonna sneeze it out, or you're gonna cry it out, or you're gonna cough it out. So many of these symptoms is actually your body trying to protect you. And when you start looking at it in this with this lens in a different way, you start realizing that your body is not broken. It's just
Right.
a really overprotective. Uh, it's really overprotective in this
Like an
case,
overprotective parent.
right? Exactly.
So,
So
so
you don't
yeah.
understand your parents when you're teenagers, but when you're in your 30s or 40s, you start to appreciate them.
That's right. So in a sense, you're saying like, of course they're positive. They're not, mast cells are not like a negative part of our body system. They're a very helpful, useful part of the protection of our body against foreign enemies. But what happens is they become overwhelmed under certain
overwhelmed.
circumstances, and therefore
Exactly.
what's supposed to be a short-term response turns into an
Mhm.
ongoing long-term response.
Exactly. It
Right. So
becomes
that
maladaptive,
right,
right? It
that's
becomes
it. That's a good word.
maladaptive,
Right.
and what we need to do, if we believe that the body has an innate wisdom, which I know both of us believe, then
Mm-hmm.
we have to start listening to our body and trying to figure out what it's trying to tell us. How
Right.
do we how do we reassure the mast cells? How do we reassure our bodies? What is
Right.
what are the threats that we are experiencing that we don't realize are threats, whether it's fluorescent lighting or even just a little bit of pollution, but our system
Right.
gets upset about it, or mold. God,
Right.
mold is such a big,
Yeah,
it's
that's
such a
right. Yeah. So it could be,
right.
so it's in some ways, it's like the body saying, I'm not happy with the conditions
Yeah,
that I'm in.
that's it.
So
Hmm.
that's not a bad take home message. Always ask yourself, what is it about the conditions that you're subjecting your body to that
Hmm.
is eliciting such a reaction?
Yeah,
That's a
100%.
pearl. That's great. Thank you, Dr. Olivia. We're going to jump into this real. Look, we're not going to get really, really technical here, but I'll just mention there are a lot of different tests for MCAS, which is the abbreviation for Mast Cell Activation Syndrome, but there's no one definitive test. It's
Hmm.
considered a clinical diagnosis. Now, if you go and see like a standard immunologist, they will generally do a test called tryptase. And if
Hmm.
that's normal, they'll often say, no, no, you don't have MCAS. And so we just, Dr. Olivia talks about this quite a bit in the course, how that's a bit of a pitfall. And you really
Hmm.
need to find a practitioner who's able to look at this a bit more deeply, not just looking at one marker, which is really more a marker of mastocytosis than mast cell activation. Would you agree with that?
Yeah,
Yeah. Yeah.
absolutely. I mean, look,
Yeah.
if you can get it, fantastic, but it's such a finicky
Yeah.
biomarker to try and catch. And I
Yeah.
think that it can be very disheartening for patients when they have clearly had a mast cell degranulation event, but the tryptase doesn't raise enough, right, to give them a
Hmm.
diagnosis, because the worst thing that can happen to them is that they then get told it's all in their head, and
Right.
then their symptoms are dismissed, which is ridiculous, because
Exactly.
we know as
Exactly.
doctors that you got to look at the patient in front of you within the context of what they're experiencing.
That's right.
And especially when you can see objective things like redness and wheals and diarrhea and all the
Yeah.
rest of it,
Yeah.
it's just it's madness.
Yeah, it's almost like a spot diagnosis sometimes. You walk into a room and it's like, okay, mast cell activation. But if people, if practitioners are still working from the assumption of it's a rare condition and you need to see a rise in tryptase, then you're probably not going to get diagnosed easily through those practitioners. So I guess our big take-home message here is you need to find a practitioner who's willing to go deeply. Now, not all, if you're in Australia, not all of these tests are available. Heparin, which I think Dr. Afrin is now saying the most sensitive test for mast cell activation, is not available here at the moment. Nor are the prostaglandin testing from urine and so on. Dr. Westerway did try to make these available. He's another wonderful doctor in this space, Dr. Mark Westerway. I want to acknowledge him as well for his input. But the other ones are available, like the tryptase and the chromogranin A, the histamine. But often the histamine will not be elevated again, once again. And it's quite common that someone has fairly severe mast cell activation, but none of the tests are showing positive. So I just want to let people know that that is a real situation, a very common situation, and that's okay. You don't need to
Yeah,
have a positive blood test to have the diagnosis. It's essentially a clinical diagnosis based on the history and so on. So
yeah.
that's very common. But these are some of the tests you can look at doing. If you're overseas, it may be easier to access some of these other tests like the prostaglandins and the heparin. Would you like to talk about intersection with other conditions like chronic fatigue syndrome and other
Mhm.
multi-system?
Yeah, actually, what might be quite helpful is to sort of
Yeah.
explain the difference between a syndrome and a disease.
Okay. Yeah.
So a disease is, a abnormal process in the body where we have identified exactly what the cause is. Okay. So we know the virus or the bacteria responsible, or the genetic mutation that's responsible for a disease. It has a very predictable path of what
I
it
see. Yep.
does, how you feel. There are predictable and known tests to do to rule you in or out. That is a disease.
Right, like
A
celiac
syndrome,
disease, you'd say would be a
like
good
celiac
example.
disease.
Yeah.
That's
Yeah.
fantastic. Exactly. Right. Or IBD,
Inflammatory
inflammatory
bowel
bowel
disease.
disease.
Yeah. Okay.
That's why the doctors know exactly what tests to do, when, what they're looking for. If it's there, it's you have it. If it's not there, you don't have it, right? It's a lot cleaner. Syndromes, on the other hand, are where you have these constellation of symptoms, and you don't have to have all of them, and you don't have to have all of them all the time, and it doesn't have to be, sometimes it's this constellation and sometimes it's that constellation, but basically it's this constellation of symptoms that seem to occur at the same time that produce what you see clinically.
Mm-hmm.
And of course, because it's a little bit more nebulous, there aren't definitive tests. Now, testing is, of course, for patients, the holy grail. It's for doctors, it's the holy grail, right? Doctors are too busy to be able to maybe spend too much time trying to think about what's going on with their patient. That's why pattern recognition is so important. But pattern recognition means that the doctor has to be aware of that syndrome, that pattern, see it enough times that they can pick it, right? And if it's still a bit unsure, they can do a couple of challenge tests to see what's what, who's who, where's where. And so Mast Cell Activation Syndrome, exactly as Dr. Sandeep said, it is a clinical diagnosis that can definitely be aided by testing, but the testing, negative tests don't say that you don't have it, basically. It's a nice to have, but not necessary. Because these bloody symptoms, right? They're also nebulous, and it's all about the pattern recognition, which is why I know patients get very frustrated when they see doctors who are not able to see the pattern, but it's because it's not a disease, it's not an algorithm as such,
Mm-hmm.
or at least not a simple algorithm, and certainly not something we were taught in medical school. Maybe they're teaching it now, I'm not sure. But that's why it's important to see a doctor who you've heard at least has some experience with the syndrome that you're concerned about, because they're able to see the patterns. Now,
Yeah.
because mast cell activation syndrome is about the degranulation, right, from these mast cells, and we know that mast cells are sentry cells, guard cells, you can of course imagine that these sentry cells aren't just fighting for mast cell activation. They're fighting for lots of different things in the system during lots of different threats at lots of different times. And so that's why you have a lot of overlap with things like allergies and asthma and fibromyalgia and GERD
Mm-hmm.
and
Mm-hmm.
POTS, because those bioactive mediators are going to evoke certain symptoms from the tissues that they are in, um, which look like other things. But for example, okay, if you get bitten by a mosquito and then you get redness, a wheal, and you get an itch, you're not going to say it's mast cell activation syndrome, right? But
Right.
it was the same mast cell that let
Right.
go of some histamine in the area to make you itch, red, and get red and swell, right? And sometimes in the gut, the mast cell is going to liberate prostaglandins, which causes cramping, right? But women liberate prostaglandins to cramp when we have our periods, but we don't say they have mast cell activation syndrome. It's the same bioactive mediator, it's the same action, right? Cramping, but clearly one is appropriate ish, right? You need the cramping so that the uterus can shed, and one may be inappropriate, and that's when you have constant or chronic cramping in the gut as part of a mast cell syndrome. Does that make sense?
Yeah, that's a lot of information, but I think that's very useful just for people to, it's kind of just breaking it down a little bit more. What does it mean to have mast cell activation and why is this crossover with so many other conditions? So thank you for that,
Yeah,
Dr. Olivia.
yeah, no worries.
So we've really kind of covered this a little bit.
Kind of following on, kind of following on.
Pardon?
This
I
is kind
lost
of
you there for a
following
second.
on from that.
Yeah, that's
This is,
following on from what we said.
yeah,
Feel free to jump in. I was just going to make that point again that we're not going to go into all the ins and outs here of how you get diagnosed, but I think the key is you've got to find someone who's MCAS literate and is known to be. So, like in Australia, there's a select group. There's people like Dr. Westerway, there's Prof. Pete Smith, there's Dr. Olivia, there's Dr. Tanya Ash down in Melbourne. There's many around the country, and ideally, you try and find one of them. So it can be more like an integrative general practitioner, can be an immunologist that's specifically interested in it, can also be like a naturopath who's specifically interested. Some naturopaths are very skilled at this as well. So there's many different types of practitioners, and it's important to keep your mind open as to which
mm.
practitioner may be best for you.
And actually, I was going to say that, if you have a compassionate, open-minded doctor, GP,
Yeah.
right, who may not necessarily be MCAS literate, but who is willing to listen to you and
Mm-hmm.
read some of the literature you bring in, right?
Yeah.
That's actually, halfway to
Right.
solving a problem too.
Yep. No, that's a
Yeah,
great point too. Thank you. Yeah.
yeah.
Great. Thank you for that. We can go off that. Now, just a couple of little diagrams here just to get you thinking about different approaches for treatment. We're not going to go into a lot of depth here, but there's a whole MCAS toolbox. Would you like to talk a
Mhm.
little bit about some of the tools that we have for dealing with MCAS, Dr. Olivia?
Yeah, yeah, absolutely. Okay, so if we understand that MCAS is the system responding to a threat, then we can do two things. One is that we can minimize those threats. So that can be for diet or environmental triggers. Is that announcement loud?
No, that's fine. It's fine. Keep
Go
going.
ahead.
You're
Oh,
fine.
it's fine.
No,
Okay.
we're fine.
So then it can be identifying what those threats are, whether it's poor sleep, environmental triggers like pollution or pollen. It can be stress, any manner of triggers. So we can work on that, and we can work on how we manage the mast cells themselves because they are being over twitchy. So they're triggering the release of those mast cells, of those bioactive mediators,
Right.
right? And so we have medications that we can use,
Mm-hmm.
we have supplements that we can use,
Mm-hmm.
and the medications include things that are specific for the mast cell, so mast cell stabilizers, or the medications can be targeting the chemicals inside, like antihistamines.
Right.
Some supplements can be helpful, but which ones? And essentially, if you understand how the bioactive mediators like histamine is broken down in the system, then you'll understand that it's by the work of two different enzymes, DAO and HNMT. So you have their
Mm-hmm.
DAO,
Mm-hmm.
diamine oxidase. You can actually buy DAO enzyme, so directly break down histamine,
Mm-hmm.
or you can support DAO production in your own body by making sure you have, good levels of zinc and copper, for example, or vitamin C, or you can use like antihistaminergic supplements like quercetin. So that's it's quite complicated. That's why it's really good to sit down with someone who actually understands these things, because we also don't want patients over medicated. We
Mm-hmm.
want to be
Mm-hmm.
listening to the body and making sure that there's an appropriate response from our end as well.
Mm-hmm.
Because if the body is trying to talk to you and the only thing you do is muzzle it and you don't take in any of the information the body is trying to give you, what is the body going to do? It's going to scream. We don't want that to happen either. What we're looking for is modulation, right? We're trying to open up bandwidth for you, your bandwidth, so that your body is able to recognize what's going on, to regulate itself, to heal. So I think that making sure that we say, yes, there are some drugs that are and supplements that are very, very helpful with regards to mast cells and their mediators, their chemicals, but we don't want to be basically medicating you to the high heavens either.
Okay, great. Yeah, no, that's very helpful. Thank you. So there's a whole wide array of things that can be used in the treatment of mast cell activation, and it's individualized. Is that right?
Yeah,
Okay.
yeah. I mean, there are some broad strokes, of
Yeah.
course,
Okay.
but
That
then
might,
yeah,
perhaps most people might go on some basic things, maybe the ketotifen and the chromalin that are pictured in this slide are quite common,
yeah,
right? But
yes,
then there
absolutely.
might be other things that one client might go on that another might not. So
And in our chat on the WhatsApp group, when we're talking about complex
yes,
diseases,
yeah,
some patients don't react to these medications well. So then you have
right.
to go, okay, when are you going to take it? How are you going to take it? What dosage? How do we introduce it into the system? Like all these sorts of things should be moderated by someone who understands the biochemistry of what's going on.
Okay, great. Thank you. That's great. So these are some of the we lost the title from the slide, but that's okay. We're just talking about what some of the triggers can be. We've already covered this actually. Is there anything more you'd like to say about the triggers, Dr. Olivia?
Yeah, I think that when patients are looking for triggers, looking for solution, they obviously are looking for a naturopath or a doctor to help them. And obviously, that is our job. That is what we're here to do. But there is actually a lot that can be said for what you can do for yourself because your mast cells, for whatever reason, don't feel safe. They feel that they are under attack. They feel that, they need to be overly, um, um, they have to be twitchy because they don't want to miss a trick. Because the immune system is very much a case of fool me once, shame on you. Fool me twice, shame on me. And they don't want to let you down. So they are going to degranulate at much lower thresholds than before because they let you down once and they're never going to do it again. Right. And so the things that we can do for ourselves with regards to mast cell activation is to make sure that we keep house where we can. And that includes emotional regulation. That includes sleep hygiene. That includes
Right,
not subjecting your body to ridiculous amounts of chemicals by way of your laundry detergent, cleaning products, makeup, shampoo, all the rest of it. There are things that you can do to
right,
ease the burden from your neuroimmune system.
right.
If your system is worried by all these threats, and those threats, as you know, are not necessarily objective, they can be subjective. And generally speaking, from an evolutionary perspective, a lot of those threats are these fandangled new chemicals that are in our system. So help it out. Get rid of the bloody, the Dove wash and the aluminium underarm antiperspirant
I'm not supposed to
and
be using Dove wash. Just joking.
and the Head and Shoulders and the what. Like there are so many good alternatives, good clean alternatives. Do that, right? If you know that the system from an evolutionary perspective would prefer a good circadian rhythm with good sleep hygiene, with good light hygiene,
Right,
do that,
right.
right? It cannot just be that you're relying on your doctor to diagnose and treat with medications and supplements because this is your journey and we are meant to be helping you. So, patients need to be part of the solution too because they're the ones that have to live with their body for the rest of their lives.
Hmm. Exactly. No, that's a great little overview there of how to think about some of the triggers and causes and get rid of them. Okay, well, that takes us to our sales pitch, guys. You knew it was coming. So here it is. This is about why you might want to join this Mast Cells Made Simple online course. I do think Olivia's done a phenomenal job with it, and these are some of the slides that she's created and that she goes through and uses to explain this condition to people. So it's basically 8 module and 25 lessons. So you get website access for 6 months, and basically there's a PDF file of each lesson, and there is also webinar archives that you have access to. So there's a lot of information there, and I think Olivia, you've probably seen tonight that she's just so good at explaining things in a simple way and helping us to understand that. And so that's one of the biggest benefits is just her breaking every little part of mast cell activation down to you. So at the end of it, you shouldn't be feeling overwhelmed and confused anymore. You should have a feeling of, okay, I understand what this whole mast cell activation thing is about and what I need to do to move forward. Is it that maybe I need to find a practitioner, or maybe you have a good practitioner, but you're not avoiding the triggers enough? Or is it that, you're not taking your protocol because you weren't clear about it? Maybe this course might help you to feel reassured that that is a reasonable thing to do, to jump onto a protocol. Or, so there could be a lot of different outcomes of it, but either way, what we want you to do is to feel confident about this condition and feel like you can move forward towards recovery. And that would be the greatest outcome that we could find from this course. Anything you want to add to that, Olivia?
No, that's a really nice. That's Thank you, Sandeep. You're very complimentary and you're very kind.
It was easy to do, put it that way. So look, we do have this discount now going for the next 48 hours, guys. And so what we'll do is put the link in the chat box, and it is at Lotus Institute hh.com. And so if you go to this item and basically put in the coupon MCAS launch, you get the 33%. It's basically one third off, and it's in US dollars, not Australian dollars, just because traditionally they've been the main audience of the institute. So $99 US, which is roughly around 147, I think. Australian, but look, I think it's worth it, particularly even if you just get one big piece out of it, that, okay, this is the sort of practitioner I need to find, and this is how I find them. I would say that's worth it just for that, because that's going to help you to take the next step that you need to move forward. So, yeah, if you follow that link, I'll put the coupon in the chat as well. So even as we move on, you'll still have it listed there. And yeah, we hope people take advantage of that. And we'd also love your feedback on the course. If there's anything that you really loved, please let us know. And if there's anything you didn't like, please let Dr. Olivia know. Just joking. All right. So we were going to take, look, I think you need to go. Look, Dr. Olivia's been already very generous with her time. She's actually at the airport in London. So I'm happy to just take the questions here, Dr. Olivia, if
No,
you want
I'm
to
okay
jump
for the
off.
moment.
You're
Yeah,
okay?
when I have
Okay.
to go, I'll jump off. Yeah.
Okay, great.
Mhm.
Okay, well, if anyone would like to put any questions in the question and answer pane, now is the time, and we can answer them. But I have one to start off with, which for me is actually was my question when I first got interested in mast cell activation, is if you say that MCAS is due to the conditions of the body not being ideal, and that the mast cells are raising the alarm in a sense to the fact that there are underlying causes in the body that are causing problems, let's say, then why do we need to treat the MCAS itself? Like, why are we treating the alarm? Why don't we just treat the cause, which was the reason that the alarm is being sounded?
That's exactly it. So we should be doing both because So, from a functional medicine perspective, where we always try to do root cause analysis and treat the cause of why someone has their symptoms, let's not forget that the patient has to live with their symptoms. They're painful, they're uncomfortable, they are distressing. We have to relieve that too. We have to make sure that patients have enough bandwidth that they can do the work that they need to be able to heal. And so that's why treating mast cells themselves can do several things. One is to help patients with their symptoms, which they're not pleasant, right? Let's acknowledge that. Mast cell
Mm-hmm.
activation syndrome can be extremely distressing, right?
Right.
And that's outside of being gaslit, that there's no issue. Two, when we treat the mast cells, we give patients bandwidth that they can go about the business of healing themselves. And three, the mast cells, that particular family of mast cells that has already been made, like, because all cells in the body turn over. Okay, your bone turns over, your bone marrow turns over, your white blood cells turn over, your mast cells turn over. That that generation of mast cells has been trained already to react in certain ways. Those ones have to be disciplined, right? Until the next generation comes through that we can reteach,
Oh, I
re-engage.
see. Okay,
Mhm.
gotcha.
So there are
That's
various reasons for it.
Yeah, that's very interesting. I hadn't heard it being explained that way, so thank you for that. So
Mhm.
Natalie asks, is the course good for practitioners? I'm a clinical nutritionist in Australia.
So I did actually try to pitch it at patients,
Mm-hmm.
and however, I made sure that I used technical language, but always explained the technical language.
Right, right.
And I knew that there would be definitely some practitioners too.
Yeah.
Now, I have to say, I have gotten more in previously. I have gotten more out of listening to well-made. I'm not saying this is a well-made course. I'm just saying, but I have gotten a lot out of courses aimed at patients because the way that the concepts are presented is a
Mm-hmm.
little bit less complicated than
Yeah.
doctors to make things, I think.
Yeah, exactly.
Yeah, and of course, we speak to patients, so trying to learn the language or trying to learn the syntax and how to talk to them can be quite important. So, I personally think that it would be good for practitioners. Just know though that my aim was at lay patients, educated lay patients, and I do use some technical things, which I apologize to the patients actually when I had to get technical because how do you not when you're talking about the immune system, unfortunately.
Yeah, that's right. And so, yeah, for instance, if you're looking to just get the basic concepts and understand, the framework of how MCAS is develops and how it happens and what needs to be done, I think it could be really, really good. If you're specifically looking for protocols, then maybe wait for me to talk Dr.
Mm.
Olivia into doing a practitioner course. Okay.
Uh,
Elizabeth asks, what is the relationship between IgG antibodies and MCAS? I have very elevated Aspergillus fumigatus IgG due to moldy house issues for several years. And after 2 weeks of antihistamines, high dose fexofenadine, it went significantly lower. So, is the IgG antibodies and the mast cell response related? I saw
yes.
IgG mentioned earlier on the slides. Thank you.
Yes. Yeah. Well, sorry, Sandeep, you're probably more experienced about this than me, but I'll just very
No,
quickly
no, that's
say
fine. No, no, no. By all means.
that mast cells are part of your innate immune system, right?
Hmm.
So the first protocol, the sentries at the gates. IgG is part of your adaptive immune system, so that comes later.
Right.
And of course, they're going to be talking to, oh, am I freezing? Anyway, and of course, they're going to be talking to each other. So there are certain subclasses of IgG, right? So IgG1, IgG3, yeah, yeah,
Oh,
I'm
okay.
pretty sure.
Okay. Yep.
IgG1 and IgG3, which can trigger mast cell degranulation through that FCY receptor,
Yeah, that's
right?
right. Okay. Now you're getting
And so then
into.
that leads to,
There you
yeah,
go.
and then that leads, I mean, to be honest with you, I think this is quite a high level question, Elizabeth. So she
Yeah,
must
I
be
like it.
a
It's an
practitioner.
interesting one for sure. But
Yeah.
definitely,
Um,
yeah, I mean, there's a huge connection with mold reactivity in general, if you take this question in another way. And, in most cases of mold illness, you are going to need to address the mast cell component. That might be a simpler
oh, yeah.
way of
Sorry. Yes,
yeah.
100%.
That all
Yeah.
right? Yeah.
Yeah. Oh, I just realized that Elizabeth is not the practitioner from the naturopath or the practitioner. Sorry, I thought
Oh,
Elizabeth
okay.
was the
Okay.
hence why such a high
Okay.
level
No, I didn't
question.
catch that. Okay.
Sorry.
Anonymous attendee says, how does one deal with the trigger of weather variation? Great question. Too
Hmm.
cold, too hot. I find it more difficult avoiding weather conditions than avoiding wrong foods, medications, or chemicals.
Yeah. So that's a really good question because it's only been in the last few years that we can explain why patients actually have these these symptomatic responses to weather, temperature, wind speeds, pressure, as in barometer. Okay. And in part, it's because of a receptor called transient receptor potential ion channels. And these are evolutionarily conserved. Now, suffice to say, these ion channels, these trips, transient receptor potential ion channels, they are triggered by pressure, by temperature, by wind, and so on and so forth. And when they take the information and they go, okay, this is a weather system change that is blah, 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 they then decide if that's a threat or not a threat. Remember,
Hmm.
it's subjective. If it decides it's a threat, for whatever reason, the mast cells are going to degranulate. So, what we're needing to do is retrain the system about what is safe and what is not safe. Okay.
Right.
And to be fair, it's never 2D or 3D or even 4D chess in these complex uh, conditions, right? We're talking 6D chess. We're talking 278D chess. Okay. So it may not necessarily be the weather, for example. Okay. I have seen patients in the past where something bad happened to them when they were a child, and that happened to be the weather pattern on that day. And subconsciously, the immune system has linked the two and so on and so forth. So
Ah,
that's why,
okay. Okay.
right, that's
That's
why
interesting.
sitting with a practitioner who's listening to your story, who can pull it all together, and more importantly, that you can go, you know what, I may never figure out why I get so, I get a mast cell reaction when the temperature goes above 30 degrees centigrade, right? But what you can do is learn to soothe yourself.
Hmm.
We're safe,
Hmm.
we're okay. Some people do tapping, other people do affirmations, some people give themselves a hug. Whatever it is that works for you, this is about trying to sell your body a story about things that it has now made connections with that are just wild for us.
Yeah, that's great. Thank you so much for that explanation, Dr. Olivia. Now, Belinda asks, why and how do hormones trigger mast cells? I'm
Mm.
currently in perimenopause, exclamation mark.
Mhm. You want to take this one?
Yeah, so sure. I mean, um, I think definitely mast cells respond to the hormonal climate.
And
Just as we're talking about the weather before, there's also the hormonal weather, right?
mhm.
And that, that the weather fluctuates a lot more for women than men,
Yeah, I mean, let's not forget as well, because
unfortunately.
I'm in perimenopause as well, right?
Okay, all right.
And
So yeah,
progesterone actually.
I've heard people say that experts in this area say that every month, if you're in perimenopause, you don't know what you're going to get. You don't know
Mhm.
whether you'll get a decent
Yeah.
amount of.
And I think to whoever's asked that
Yeah.
question, I look, Belinda, I feel you, right? But what you have to understand in perimenopause, our hormones are
Right.
fluctuating, right? The estrogen and the progesterone, they're kind of going wild a little bit whilst getting into like heading towards the menopause where it's going to stabilize.
Mm.
And essentially, you'll find that progesterone has a stabilizing effect on mast cells,
Yeah.
whereas estrogen has a degranulation enhancing effect
Yeah.
on mast
That's right.
cells. That and also um, the is it the granulosa cells of the ovaries has
Now you get into
receptors,
technicalities.
has histamine receptors, and histamine has estrogen receptors. So
Yeah.
So you can see why there's this.
Yeah. Yeah.
It definitely works in perimenopause. Just put it
That's right.
for sure.
It must be really difficult just not knowing what you're going to get every month. And one month
Mhm,
your mast cells and your estrogen are going crazy, and the next month they're not. It's just
mhm.
like, a little bit of the luck of the draw. So it is a difficult period. And
Yeah.
I guess it's all about knowing yourself and knowing when you need a little bit more rest and a little bit more understanding from those around you.
And a little bit more progesterone. I actually have to go. So
Yeah,
thank you so
yeah, no
much.
worries. Thank you so much, Dr. Olivia. Really appreciate your time, and
Okay.
we'll keep in touch. And I
All
hope
right. Bye,
people,
guys.
yeah, take advantage
Thank
of
you.
your amazing course.
Thanks.
All right, guys, we've got a couple more questions, so I don't mind trying to answer that while, yeah, before we wrap up here. So, next question is from Leanne, who asks, are there evolving links to neurodivergent individuals and or hypermobility and MCAS? Any reasons why? Well, the one I've looked at more is hypermobility, and there definitely is a huge link between hypermobility, particularly hypermobile Ehlers-Danlos syndrome and mast cell activation. And my understanding is it's to do with the connective tissue itself. So when you have like a weakness in the connective tissues, it tends to liberate the mast cells more, and it tends to predispose predispose you to developing mast cell activation. So often there will still have to be a trigger, and I still find that mold and dampness and mold, and also COVID and COVID spike protein are two of the biggest triggers at the moment, which will trigger people to express the mast cell activation phenotype, if you like. And so that's definitely a big thing. It's likely that neurodivergent individuals actually have a degree of MCAS playing out for them all the time. So I think it's not 100% clear actually which is the chicken and which is the egg. Is it the mast cells which are kind of triggering neuroinflammation and neurodivergency, or is it the underlying abnormal neurochemistry of being neurodivergent that's triggering mast cells? But there does definitely appear to be an association there, and it's something that I would definitely like to see more research into. So now the questions are coming. Uh, okay, so anonymous attendee asks, is it beneficial to take MCAS treatments while still exposed to mold or not yet able to move? I would say yes, absolutely. You need to just try and take the edge off the inflammation while you are gathering your resources to move. And so often mast cell supplements plus doing nervous system retraining. So that can be the Gupta program, it can be Primal Trust, DNRS, ANS Rewire. It can also be just vagus nerve exercises. All of those are very, very important as well when you're being exposed to mold, just to dampen down the danger response. Because in a sense, it's like your body and your nervous system are basically setting off like a danger alarm. And you've basically, if you're already aware of the danger, then essentially you're saying, thank you very much, but I don't require this danger signal. So I'm going to just dampen you down a little bit, and I'm going to find a way to get away from this dampness and mold so that I can be in a much better position in terms of my health. Hope that helps. Then we've got Nahal, I hope I pronounced that right, has asked, is a psychological trauma history or physical events or both the main predisposer to mast cell symptoms? That's a great question. And I mean, basically, we don't know. Like, can't give you any percentages on that. I don't think that has been elucidated, but it can clearly be emotional trauma can be a huge trigger for mast cell activation. There's no doubt about it. I'm personally of the view that often emotional trauma will weaken the body and weaken certain organs of the body, and then often infections or toxicity will come in to that organ, and then the mast cell activation comes later. So I actually believe in most cases it is actually a combination of emotional and physical factors that then lead to mast cell activation. And Karen asks, what are your thoughts on the low histamine and anti-inflammatory diets to help calm the system down? Yeah, so I think it's worth trying the low histamine diet. However, what I don't think is worthwhile is if you don't get a benefit symptomatically with it, just staying on it for life, because there's also downsides to being on a very restrictive diet. Like, it does affect the microbiome that you're having so little variety, for instance, in the diet. So I would say only continue this. And I know other authors like Dr. Neil Nathan agree with this. Only continue like a low histamine diet if you notice there's a benefit. Now, anti-inflammatory diet, I don't exactly know which one you're referring to, but let's say we're just talking about it like more of a gluten-free, dairy-free, sugar-free diet. Well, that's going to be very important overall, because what you're doing there is you're not feeding the wrong microbes in the body, and you're not feeding leaky gut, and you're basically trying to remove as much stress from the body in the form of food allergens as possible. So I do think that, yes, you definitely need to be careful with the diet to some degree, but then there's that fine line. Like, I've known people who are on 2 or 3 foods only, and I think if possible, as you go along the mast cell journey, you want to try and broaden the number of foods you're on. However, within reason. I don't think including foods which are clearly harmful is going to be beneficial. So there's a fine line there, but I think avoiding the clearly detrimental foods while trying to keep as broad a variety as you can without triggering yourself is the best way to go. Hope that helps. Natasha asks, is it possible to have local MCAS in a specific area of the body rather than only systemically rather? Yeah, I understand that's the case. And Emily Givler, who's a practitioner over in, I guess, Philadelphia or Pennsylvania over in the United States, explained that to me, that, for instance, you can just get local nasal mast cell activation. That's actually a very common thing. And sometimes in that case, just using like localized sodium chromoglycate nasal spray may be the way to go. So that's definitely possible, and it's a great question. Stephen says the drug beta-key remibrutinib stops mast cell activation and is being used in the USA to treat urticaria. Will it be available in Australia under the PBS? Well, there are, yeah. So Dr. Afrin used to talk about imatinib. I think those medications go under the broad category of tyrosine kinase inhibitors. And so there are some of these are available here, but often the range of medications in Australia won't be quite as broad as the United States, but hopefully. Luna asks, would you know any Chinese practitioner in Queensland, if not any other parts of Australia, who has knowledge in mast cell activation? I might have to pass on that one, sorry. I'm sure there are. But I can't think of anyone who literally basically advertises themselves as being knowledgeable in mast cell activation. So sorry, I couldn't help with that one. Do you recommend coffee enemas for detoxing mold? Yeah, so there hasn't actually been research on this particular topic, but anecdotally, it does appear to be a very, very useful procedure. And sometimes when, for instance, you're not seeing any mycotoxins showing up on a urine mycotoxin test, and then people start doing detox procedures like infrared saunas and coffee enemas, all of a sudden, the mycotoxins start showing up. So what the coffee enemas do is they help the liver, they help to unblock that limiting step in detoxification, which is the liver. So great question again. You sometimes have to be a bit careful with saunas. if you're a mast cell patient, because heat can be a trigger for many people. So I suggest going low and slow for mast cell patients if you're doing an infrared sauna, and see how much you can tolerate, and just gradually increase your time and your heat in the sauna, because there's no use if you're basically getting a triggering of your mast cells. I would say it's probably not worth it. So that brings us to the end of the questions. Thank you for the excellent questions, everyone, and for your attendance today. I'd also like to just do a quick shout out to Caleb and Andrew, who are our staff working away in the background. Much appreciation for them. Caleb does have a message for us that if you decide to join to the Mast Cell Made Simple course, the modules will be available in a drip feed manner over the next few weeks. So you'll be able to access the first module straight away, and then the second module one day after your enrollment, and then your third module 2 days from the enrollment, and then the following modules in a similar kind of fashion. So just be aware that you can't just race through and do all 8 modules in the first day, but I would recommend you don't try and race through the course anyway. I'd recommend take it slow and steady, and try and digest the information that Olivia's giving, because it's very, very useful. So look, thank you very much, everyone, for coming along tonight. I hope you enjoyed getting to speak to Dr. Olivia and really hear a little bit about her excellent work on mast cell activation. So thank you very much once again, and good night, everyone.